Good afternoon. Welcome to the Committee on Health's hearing today. Let's go ahead and get started. Dr. Arambula. Dr. Arambula has two bills before us, AB 1900 and AB 1995. And we'll start with AB 1900.
Good afternoon, Mr. Chair and members. AB 1900 will allow Californians who are older and disabled to keep more of their monthly income to pay for necessities like food, clothes, and shelter while still qualifying for Medi-Cal. Despite our high cost of living here in California, we trail behind several states in how much people in certain Medi-Cal programs must pay for their own health care before Medi-Cal kicks in. Today, older adults and people with disabilities who are just $1 over the free Medi-Cal limit are forced to survive on just $600 to pay for their rent, for their food, and their utilities, as well as all of their other expenses. This program has not been updated since 1989, and older adults and people with disabilities are paying the price. This is simply a matter of fairness for Californians who are struggling to make ends meet and need access to health care. By making this much-needed adjustment with AB 1900, we can help to ease the financial burdens so that people are not choosing between the need for medical attention and the need to pay for rent and to buy food. It is time for us to ditch the deductible and to make California a leader in Medi-Cal affordability for seniors and people with disabilities. Testifying in support of AB 1900 are Sawait Seyoum from Disability Rights California, as well as Bea Layugan from the California Advocates for Nursing Home Reform.
Thank you very much. Please go ahead when you're ready. Next witness, please.
Thank you. Good afternoon, Chair and members of the Assembly Health Committee. Thank you for the opportunity to provide testimony in support of AB 1900. I'm Bea Layugan, a long-term care advocate with California Advocates for Nursing Home Reform. My testimony today is on behalf of a client of mine who was unable to appear in person. Her name is Nati Cheverine, and this is about her parents, Jose and Alicia. Nati called our offices to learn more about Medi-Cal eligibility for her father, Jose, who is 77 years old, and her mother, Alicia, who is 78 years old. Both of them are immigrants who have been living in the United States for over 54 years. Jose worked 2 jobs, and after 41 years of working, he retired. Shortly after, Alicia began to show early signs of Alzheimer's and relied on Jose as her primary caregiver until his health started to decline as well. Nati and her siblings hope to find in-home support through Medi-Cal for both of her parents. Jose and Alicia's total monthly income is $2,500, which puts them above the 138% federal poverty level for a couple, meaning that if they apply for Medi-Cal together, they will have a share of cost. The problem is their share of cost would be $1,566 because the maintenance need level for a couple is only $934. This leaves Jose and Alicia without enough money to pay for other necessities such as rent, food, or utilities. Nati and her siblings are already helping with the bills, but with the share of cost that high, the family could not afford for both parents to apply for Medi-Cal. In order to avoid a huge share of cost, the only option for Nati's parents would be to prioritize the parent with the higher need and submit a Medi-Cal application seeking spousal impoverishment protections. Although her mom requires a lot of care, the family decided to only have Jose apply as his health was declining rapidly. This is a common problem that I've come across during my time at CANHR, where families have to choose between which parent receives care because they could not afford the share of cost. If the maintenance need level is increased to match the 138% federal poverty level, Jose and Alicia's share of cost would only be $394, which would be a lot more feasible for Nati's family and would allow both Jose and Alicia to receive services through Medi-Cal. Increasing the maintenance need level would allow older and disabled Californians access to necessary care while keeping more money to remain in the community. Nati says, I'm asking for a reform of the healthcare system that addresses the medical needs of minority groups like my parents. These are my parents. They have raised great children, and they deserve to enjoy their family in retirement. For this reason, I urge the committee to vote aye on AB 1900. Thank you.